So my name is Shanel Sharma. I'm an eye surgeon. My interest areas are cataract surgery and strabismus surgery. If you look at what's happened in the last 5 years, we have evolved remarkably. We have now lots of medications for macular degeneration, which we didn't previously have. We are able now to improve people's sights where previously we told patients that, I'm sorry, you're going to lose your vision. We now have evolving technology with lens designs for cataract surgery, and our area of ophthalmology has a lot of advancing diagnostic equipment currently and coming in the near future, as well as medications, stem cell and gene therapies are really exciting. Well, I think GPs have the hardest job because they have to work out, for example, in our specialty, which is the patient with the red eye that could go blind this afternoon, and which is the red eye that they can wait, which is the patient who's got macular degeneration, and which is the patient who just needs a pair of glasses. And that's the same that they need to know that for cardiac diseases, which is the patient having the heart attack today, which is the patient who has just indigestion. So they need to be across all specialties. So this gives them a forum where they get to meet specialists and update their skills and their knowledge in all the different areas. They also have access to industry and what's happening in the marketplace, what's happening with technological developments, and they get networking opportunities both amongst themselves and amongst their specialist colleagues. And it's the same for specialists. We get to meet each other too, and our GP colleagues. Macular degeneration is a condition whose prevalence is on the rise in a massive way. It causes 50% of blindness in Australians, and it's increasing. So for GPs, knowing how to simply assess whether a patient has a macular problem or not with an Amblyopia grid has been one of the things that I thought was important for them to learn today. Other areas such as patients with cataract surgery, we talk about how cataract surgery improves vision, but it's also been shown to reduce the number of car accidents by 23%. It reduces hip fractures, it reduces mental health problems, improves sleep cycles, and even patients with Alzheimer's in certain studies, it's been shown to improve their cognitive abilities. So I think that remembering cataracts, even as patients get older, is an important thing for GPs to have. Glaucoma is a condition which we also covered briefly, and it's a condition that's the second major cause of blindness in Australia. It causes 16% of blindness by the latest statistics. And that's despite, if you think about how many patients go to the optometrist and have their pressures checked. So we need to remind GPs that 50% of patients with glaucoma have normal pressures, so they will be missed by just a pressure check. So you need to look at other risk factors such as the patient's increasing age, family history, whether they take steroids of any sort, including steroid creams, steroid inhalers, steroid up their nose as a nasal spray, if they have a history of migraines, have a history of Raynaud's, whether they take their blood pressure medication at night, that's been shown to cause glaucoma to progress. So all of those factors are important for GPs to be aware of in getting their patients screened, because earlier detection leads to fewer cases of blindness. We also covered patients with strabismus. Any patient who has an acute onset turn needs to be considered for a life-threatening pathology such as a brain tumour or other cranial nerve pathologies like giant cell arteritis. And finally, we covered children being screened for amblyopia, because now a lot of GPs are having to do 4-year-old vision checks, and with this, if we miss children who have amblyopia through this check, then they lose that ability to have lifelong vision in one eye.